Well, it's that time of year again when we're spending more time outside, which makes us susceptible to Lyme disease, a tick-borne illness. I sat down with Jessica Menard, a nurse practitioner at Holyoke Medical Group, to learn more about the symptoms and the best way to protect yourself.
So generally Lyme disease, it's a tick-borne illness that occurs when an infected tick bites you. Once that tick bites you, it can transmit the bacteria that causes Lyme disease from its body to yours.
Okay, so what symptoms are we talking about that people would notice?
So generally the first symptoms that you might notice is a rash. It can look like a bullseye, where the center part of it's kind of skin colored and the other part around it is a little red. Only about 70 to 80% of people may develop this rash. Other symptoms we can look out for are just fever, fatigue, joint pain, just generally feeling ill, just not yourself.
And how long do those symptoms take to be revealed to you?
So the symptoms can be revealed anywhere between day 3 and up to a month after being bitten by that tick.
So that's kind of a long time. Yeah. So if you don't have the bullseye rash, which some people don't,
yes,
you could be walking around with it and having no idea, right?
Exactly.
So that's a big challenge, I'm assuming, for people in your business.
Absolutely.
What do you see as far as, this time of year when people come in, with those types of symptoms? Are you automatically thinking, all right, we need to test them?
It's always on my radar just because one of my professors back when I was in school always mentioned Lyme disease. It's always on my differential diagnosis with those vague symptoms, those viral symptoms that an individual may have. So in the back of my head, especially this time of year, I'm always thinking about Lyme disease.
Okay, so what's the next step? So you go into the doctor, you bring your son or daughter, or maybe it's yourself, you describe the symptoms, and then what's the next step?
So generally, some people do know that they were bitten by a tick. If they don't know that they're bitten by a tick, I generally kind of probe them to ask if they've noticed any kind of rashes or any of those symptoms that I mentioned. And then the next step would be if I do suspect Lyme disease, I would order some blood work just to confirm it.
Okay, and how long does that typically take to come back?
Usually a couple days. It doesn't take too long. We usually do a Lyme titer first, and if that would detect early or late disease, and if that comes back positive, we would run a second test just to confirm it, and if both are positive, then that would be a diagnosis of Lyme disease.
And so what kind of medication and follow-up is done from there?
So generally, if they have Lyme disease, or we suspect just by symptom base, because if they do have the traditional symptoms of Lyme disease and that bullseye rash, we can start treatment right there, and I would run the blood work probably in another 6 weeks after that just to confirm it, but we can treat right away because early treatment is crucial. We would treat them with antibiotics, specifically doxycycline, also Ceftin or amoxicillin, generally for about 2 to 3 weeks.
Okay, when you said that early treatment is crucial, why is that?
Just so, it doesn't progress into late stages of the disease. That could be detrimental and cause other, bad issues with the patient.
And so, it's interesting that you say that because I know that, just talking to different friends, their kids went in to the doctor and the first test didn't catch it and then it had to be tested again. So long-term or late Lyme disease, what are those symptoms that come about?
Yeah, so late Lyme disease, generally arthritis, like severe arthritis of like major joints, like the knees, the shoulders. They can also have a severe fatigue, numbness and tingling, a little short-term memory issues, trouble sleeping, sometimes even palpitations, shortness of breath, other things like that.
So let's say somebody comes in, had no idea that they were bitten, has been dealing with these symptoms, and it's 3 months out now. Would a test detect that, yes, you were bitten by a tick?
It might show the late disease, yeah, but I probably would want to, it would be in the back of my mind to test for that, but I'd probably make sure that there's nothing else going on, because sometimes we're too quick to say that's Lyme disease,
right.
But, there might be something else chronic going on, and we don't want to mistreat or misdiagnose a patient and just give them the antibiotics. So we want to make sure there's nothing else going on.
And so if they come in with those symptoms, will the antibiotic reverse what they're feeling, or is that...
If they're treated within, a timely fashion, like when we catch it early, they do make a full recovery.
Okay, but but it's possible that they're going to be dealing with that if not.
It's possible that they could have what's called chronic Lyme syndrome. If, sometimes even if treated in a timely fashion, they may have these vague symptoms up to a year after that come and go. But the earlier the treatment, the better prognosis for the patient.
And when you think about it, it's all from this little bug that is in the backyard. Or wherever, and
That's everywhere.
So what's your advice? As people are working out in the yard this summer, or they're hiking with their kids, what are we supposed to do?
So the best advice I can give is just to check yourself every day, especially this season. Ticks live in grassy, bushy, woody areas, but they can also just be in our backyard if we live in an area like that. So the best way to protect yourself would be to wear protective clothing, long sleeves. I know it's summer months, but even if you don't, definitely checking your body, checking the areas you can't see, or having somebody else check those areas.
Especially for little kids, like on their heads.
Their heads, in their ears, even in the belly button, behind the legs. They like to go in places where you can't see them.
And so I know they're tiny, but when they bite you, they start to blow up. But
Yes.
Sometimes it could be confused with maybe another bug. I know that, sometimes you get a little bit paranoid. Oh my gosh, that's a tick.
I do see that a lot. Everybody's coming in for bites, and I encourage that, even if they're not tick bites, because sometimes even a local reaction from a spider or another insect can kind of cause that circular rash that may or may not be. People can confuse it with the classic bullseye rash from a tick.
Are there other diseases that have present similar symptoms as Lyme disease that sometimes, will throw doctors as you're trying to diagnose this?
Oh, absolutely. It's a tough one sometimes if it's not classic symptoms. We might think an individual would have the flu or a viral illness. They could also be confused with fibromyalgia, also systemic lupus. All those things can kind of throw doctors for a loop sometimes if it's vague.
Okay. And also, I had heard that, again, a family member had Lyme disease and presented almost with paralysis in the face, which I know that would be, a later sign, but you would never think that would happen.
That would, if they had a facial palsy, the initial thing we would want to check is if they had a stroke. But some late signs of Lyme disease would be that facial palsy. Could also have Lyme carditis, which is an infection in the heart that can cause palpitations, dizziness, and trouble breathing. Also Lyme encephalopathy, which would be some brain damage, just would cause that short-term memory. Those are the real detrimental long-term effects that could happen.
So bottom line, just really protect your family and yourself, wearing long sleeves and I guess bug spray as well.
Bug spray, yep, insect repellent. But the best thing, I know it's summer months again, so wearing long sleeves is always tough, but just checking after. After you're outside, take a shower within 2 hours, toss those clothes in the dryer on high heat, just to kill the ticks. And really, check your clothes, because the tick may be on your clothes and not attached to you, or even on your pets that go outside. And then once the tick is brought into the house, it could bite you later.